Good day everyone, I am Senior Clerk Venice Nunez and I will be demonstrating how to properly suture an open wound. Before you start, make sure to introduce yourself to the patient and explain what you are about to do. Ask for any allergies, secure consent form, prepare the materials prior, do proper hand washing, proper gloving of hands, and proper draping of the wound site. Calculate for the proper dosage of the anesthetic to be used. For lidocaine, it is given at 5 mg per kilogram, and for lidocaine with epinephrine, it is given at 7 mg per kilogram. Here is a sample computation for a 50 kg patient. Materials needed are syringe, local anesthetic, suture needles, needle holder, tissue forceps, surgical scissors, and a suture pad or an alternative. Infiltration of local anesthesia. Aspirate with a syringe the computed amount of anesthetic to be used. The anesthetic bottle is considered unsterile, so if you're aspirating directly from the bottle, make sure to use your ungloved hand or ask an assistant to hold the bottle for you. In my case, the anesthetic was already transferred into a sterile cup prior to the procedure. Make sure to observe sterility at all times. Remove air bubbles from the syringe. With the bevel up, inject the needle subcutaneously around the site of the wound. Make sure to aspirate before injecting the anesthetic to make sure you don't hit any blood vessels. You'll know if you've hit a vessel when there's backflow of blood in the syringe. Carefully infiltrate the subcutaneous layer around the site to be sutured. Check the effect of the local anesthetic using the tip of the needle and make sure to look at the reaction of the patient whether he or she is feeling any pain. Simple interrupted suturing technique. This is the most commonly used technique in closing a wound. It is important to handle all instruments properly. Use the tripod grip technique for the needle holder by holding it with the ring finger and thumb of the dominant hand in a prone position, while the other hand will hold the tissue forceps using the pencil grip technique. Use the tissue forceps with one hand to hold and position the needle at the tip of the needle holder about 2/3 midway of the needle. Start suturing by approaching one side of the open wound with the needle perpendicular to and about 1 cm from the edge. A gentle rotation of the wrist subsequently follows until the needle exits the other side of the wound. The length of the suture is adjusted and an instrument knot tie or a square knot is performed. This is accomplished by alternating sides as the suture is twisted around the needle holder. The knot should be tightened sufficiently without constricting the tissue and impeding blood flow. Grab the suture scissors and hold them using the tripod grip. Cut the suture about 1 cm from the knot. The procedure is repeated along the entire length of the wound. It is important to position the knots on one side and not directly on the wound edge so as not to disturb the healing process. Ensure that the knot is tightly done in order to achieve wound approximation. Lastly, dispose of the contaminated materials into their respective receptacles. And you're done! I hope you learned a lot from my video, and thank you so much for watching.